Hello and welcome to Talk to Tony Wilson. Going to start with the recap. This is still October and it is Breast Cancer Awareness Month. But I want to make it clear that breast cancer awareness is not just for women, it's for men as well. Studies show that male breast cancer is prevalent in about 1 in every 1,000 cases. Some studies show that it's 1% of all breast cancer cases. So for men and women, if you have breast cancer in your family, that puts you at greater risk. How breast cancer is found in men is basically the same as for women. You do your monthly breast exam or chest exam if you're not comfortable saying breast on a male. If a nodule is found, you take it to one of your medical providers. They'll do a test on it. They may have to do a biopsy or a needle aspiration. They may have to go in and remove the nodule and do further testing on it to see exactly what that nodule is. So again, for the month of October, I'd say it's Breast Cancer Awareness Month, and it's not just for women. Well, October brings something else. Is that flu shot season again. And I'm just going to let you know, I take my flu shot every year. I have for the past 15 years, and I haven't gotten the flu from it. But I'm just going to put in that disclaimer anyway. I'm not telling you that you have to take it, and neither am I telling you not to take it. I'm just telling you I have taken it for the past 15 years, and it has not given me the flu. I know I haven't given you all much of my background, but I have been a nurse for close to 30 years now. And I'll tell you, this year, one of the most common questions I've gotten about the flu shot is, do we still need it even though we're keeping our mouths and nose covered, we're keeping our distance, and doing what we can to keep ourselves healthy because of the coronavirus? Well, my answer to that is yes, and it's just not an answer that I just come up with myself. I do lots of research, I do lots of studying, I watch the news, different websites, and that answer about whether or not you need to flu shot, even if you're keeping your distance, keeping your mouth and nose covered when you're in public, and keeping your hands washed, that answer is still yes. You still need to get your flu shot because even though we do all that the CDC and the World Health Organization is suggesting that we do to keep coronavirus away, some of those same things are good to keep the flu away. But nothing is 100%. So the more protection that you give yourself, the less of a chance you're going to come down with that flu. So whether you need to take the flu vaccine since we're doing what we need to do for coronavirus, that answer is yes. The flu vaccine is recommended for everyone over 6 months of age, unless you've had a previous life-threatening reaction from it, or you've been diagnosed with a syndrome called Guillain-Barré. And I'll spell that for you so you can look it up. It's Guillain dash Barre, Guillain-Barré. But some of the common reactions to a flu shot is similar to those what a child would get when they have their vaccinations for school, which is soreness to the site where the injection went in. You may have some redness or swelling to that site. You may have some muscle ache, or you may have just a small fever. So I mentioned life-threatening responses, and if you've had one in the past to the flu shot, that you really need to talk to your doctor before you get it again. But let me explain what a life-threatening reaction is. It's not just something that comes from a flu shot. It can basically come from any invader in your body. Remember we talked about the immune system and what the immune system does? It finds things that's in your body and it tries to get rid of it. So basically, what has happened with somebody that has had a life-threatening response, they had an overreaction from their immune system. In the case of the flu shot, what has been seen, I can't say that it's common, but what has been seen is that it may have caused some hive, it may have caused some facial swelling, it may have caused some trouble breathing, a rapid heartbeat, some dizziness. If you do have that type of response to anything, that is a pure emergency, and you need to call 911 and get some medical assistance right away. So, that flu shot. I'm giving you the information that I know. That's up to you what you decide you want to do with it. Whether you take that flu shot or you don't take that flu shot. I suggest that we keep ourselves as healthy as we possibly can. Well, this is all for another Talk to Tony Wilson. And to all I will say is have a great day.